Hello, my name is Rita and welcome to this next in the series of Aging with Attitude. For our out in the community viewers, you probably already know that Aging with Attitude is primarily information for the 45 to 64 and those good healthy lifestyles as we sort of enter that next phase of our life. And of course, it's also for the people that support them and recognize that that's a really important time to be looking after our health and developing new habits and new ways of thinking and what is our next phase of life is going to be. For today's session, we have a couple of special hosts. We have, and before I'll just talk to you a little bit about this particular episode. This one I'm calling Your Heart Matters. And I'm going to share a little bit about my own personal story. And so Your Heart Matters was inspired because early last year, I had a couple of heart attacks. So, I mean, this is really the first time I'm sharing publicly on a community TV, and that's a little why I haven't been doing so many episodes, but I am fine. I'm well. And through my journey, I have discovered a few very special people in rural BC. My situation was, I mean, I've since learned that women can experience heart attacks in very different ways. We don't always have to die. Those of us that live in Prince George, in my experience, it just was something that felt like indigestion. And when I wound up in the Prince George emergency in the hospital, then I was sent to Kelowna because they have a cardiac unit there, and I discovered we didn't have one. So that was what prompted me to really, see what I could do. And I did get better with time. It is a long process. But today I want to talk a little bit about, we've got our doctor here. I've since found out that Prince George has acquired a cardiologist, and the other guest that we have is a lady out of her Kelowna studio, and she really kind of focuses on that rehab and prehab and rural areas. So with that, I'd like to start off our interview with our cardiologist and in Prince George, Dr. Ahmed Merghani, and say a little bit about him. Dr. Merghani, hello.
Hello, hi Rita.
Hi.
Thank you for inviting me. Yeah.
So one of those things, and you're fairly new to Prince George, BC, and Canada. Can you talk a little bit about why you chose to come here and what you see special about Prince George and just what you think is possible for Prince George?
Thank you, Rita. Yes, so I'm a cardiologist. I have moved from the UK approximately a year and a half ago. I undertook all my cardiology training in the UK, and that includes a PhD in cardiology. And yeah, I often get asked this a lot. Why did I move from working in a sort of a big cardiac center to working in Prince George? Well, I think the answer to that is very simple. It's for patients like yourself who have gone through it, and they appreciate that actually looking after cardiac conditions requires expertise, requires a multidisciplinary team, not just cardiologists, but it needs both technical and practical experience. And this is where it was lacking. I always see myself as wanting to make a difference in people's lives. And there's no better place to make a difference in an area where you are needed. Where I was working previously, there was 80 cardiologists under one roof. In all of Northern Health, which is the size of France, there's only one cardiologist. So, I have a massive impact on people's lives, and that makes me feel better. And of course, Prince George and Northern Health and the Northern BC is a beautiful part of the world. I think I visited a couple of times before I got here, and I was always taken back by just the natural beauty. And not just the natural beauty, but just the people who are here. They're just very open, very friendly, down to earth. And it certainly helps when you're able to get to work and home within 10 minutes. So my commute journey has gone from an hour to 10 minutes. So these are the many reasons why I decided to make that move. I've got a very young family. We've got four children, all under the age of 10. And we really wanted them to grow up in a safe community surrounded by friends and things that they're able to do, lots of outdoor activities. And that was one of the main pluses for us. So yes, working in as a cardiologist in Prince George has been difficult and different, I would say. It's a challenge, but it's a challenge that I knew when I first started that there's always going to be a challenge. Working in a remote area and trying to deliver excellent care with the limited resources. But with engagement with patients like yourself, Rita, and others, I think it's clear that there's an appetite for change, that the cardiac infrastructure needs to grow. And that is all happening in the background. As you probably are aware, there's a cardiac program which has been ongoing for the past few years, and there is a strong ethos to deliver tertiary cardiac care in the short to medium term. So we're building an acute cardiac tower, which is hopefully going to take shape perhaps in the next 5 to 10 years. And that's really exciting for me because it shows that the North is serious about delivering cardiac care, and it shows that we're going to be able to deliver excellent care within the community that we have, as opposed to people like yourself having to travel to remote areas of the province, hundreds of kilometers to get the same care. So we're really excited about that. That's something that's certainly in the pipeline in the future. But yeah, so this is just a bit about myself, my background, why I've decided to come to Prince George, and hopefully the vision going forward.
Well, thank you so much. Before we go on to Shawna in her fitness studio, I just want to say that, I did a little bit of research on Dr. Merghani before I set up this episode, and I did find out that, he's there was some things about athletic, being an athlete and that sort of thing, and so I was kind of excited about that, and I felt somewhat inspired over my own personal journey. I've also found that it's important to maintain that prehab and rehab, and quite frankly, I never heard of the word prehab before I started seeing it on people's websites and out there in the medical community. And I know that rehab is possible. I am a living example. So through my journey, I met up with Shawna, and Shawna Cook. She is in her Pulse Cardiac Health studio, and I actually, she offered 1 month worth of free tryout of her Zoom class exercises, which I have been doing somewhat regularly. But it's really a top of mind awareness for me as somebody that is went through the lived experience part of things, that we need to have that sense of community and people that have experienced this. It's not just like an ordinary class. We like to talk to other people that have actually went through and survived heart attacks and changed their lifestyle because of it, and I'm one of them. So with that, I'd like to ask Shawna, why did you start this business? What are some of the more important exercises? Can you show us?
Hi, nice to meet you. Thanks for having me. Yes, so why we started it? Well, it's kind of very much tacking on to what's been said already. Is we have family that are in rural health. I'm a clinical exercise physiologist, and my husband and partner is a cardiac nurse, and I have worked in cardiac rehab for close to 15 years now. And we know that it's, the people that come to the hospital in the main center get all the treatment, and those that end up having to go back to their homes in more rural areas really get left kind of more or less figuring it out on their own and not really the same level of treatment. And so the reason that we started our business was so that we could bring the treatment to them. So this was pre-COVID, before everything went virtual, that we started doing our actual cardiac rehab program, which is a combination of education and exercise. We monitor heart rates, blood pressures, all through our web system, so that we're able to bring rehab to people that need it. We have people after open heart, valve surgery, bypass, heart attacks, the whole gamut, AFib, whatever it might be. And it's been the same thing. We feel like it's been something of great value for us personally, because we see how we've been able to bring support to people that otherwise didn't have the same level of support. And so, yeah, we just really wanted to make sure that we were able to give it to the areas that needed it. And so that's why we started our program, and then COVID hit and everyone went virtual. And so now it's just grown and grown and grown. So we're quite happy to keep going and helping support people as much as we can, and the prevention side of it as well. Obviously, people with risk factors, we're wanting to do some risk factor reduction, talk about lifestyle change and things that we can do overall to reduce our overall cardiovascular risk. So that's a big part of what we do as well. So in terms of exercises, that's kind of a loaded question there, Miss Rita. It really, depending on what stage people are at with their cardiovascular rehabilitation, or if they're in prehab, is kind of, depending on that is what we prescribe for them in particular. But overall, if you're wanting me to demonstrate something, I typically, specifically for the people in the age group that you're talking about, that 45 to 64 age group, I really like to focus on strength training. We as a population lose a lot of our muscle mass and strength as we age, and it's that muscle mass and strength that we need to keep us independent and functioning the way we want to function throughout our life, regardless of whether we have heart disease or not. But it definitely can help. Strength can definitely help, and muscle mass in the way of weight reduction and things like that, to help us blood sugar control, in terms of helping with those risk factors that we want to reduce. So I always say youth is in the glutes, those bum cheeks, those bums that you're sitting on right now. That's where a lot of that youth comes. And so if I was to demonstrate a couple exercises, I'd probably demonstrate some things to work on those hips. So are you wanting me to do that for you? Yes, she's nodding yes. Okay. Okay. So just something super, super simple. We tend to, in our Zoom classes, we have people either sitting, standing, depending on what they are capable or feeling comfortable with. We often use these bands. Something really simple is a deadlift. Now, deadlift sounds kind of scary, but it's not really super scary. You just stand on your band. Your knees are going to have a soft little bend, and it all comes through the hips. So you're going to hinge at your hips. You're going to grab that band nice and low, and you're going to squeeze those bum cheeks as you stand up, and then nice and slow and controlled down, squeezing those bum cheeks. So as you're doing that, you're driving those hips forward. And this is really going to activate those glutes. Great for those with low back issues. And it's a really gentle kind of exercise on the body as well. So you don't really, if you have little knee injuries or hip injuries, it's an okay one to do. And for those that are a little less potentially stable on their feet, I like to get them doing some seated sit to stand. So just something super simple. I'll bring my chair out here. So just a squat where you're going to plant your bum into the chair, nose over toes, and standing up. So you can continue on just with sit to stands. You can just do regular air squats, working on form of trying to keep that chest up, hovering over that seat, knowing it's there to catch you if you need to. And you can even start to do one leg. So you can put one foot out in front, sit those hips back, and then putting more weight into one leg to work on that strength in those hips and in those legs. So a little demo if you wanted something.
Well, thanks so much thanks for doing that, Shawna. And if anybody in our viewing audience wanted to maybe check this out and get your free 30-day demo, what do they do? Do they look you up on your website and email you?
Yes, absolutely. So on our website, there's just a registration if you'd like to come in and do the Zoom. And of course, I'm just going to connect with you quickly to find out kind of where you're at, so that I can kind of help guide you through in the Zoom classes if I want you to avoid certain exercises or modify exercises. I can do that for you. So yeah, just register on our website, pulsecardiachealth.com, and we'll get you started.
Thanks so much there, Shawna. And if we could go back to Dr. Merghani and let's start our little recap. And maybe you can talk a little bit about exercise and, the whole possibility of athletes and I know that I had a real fear of overexerting myself. And then I heard that, people can actually get athletic. Can you just do a little recap on that?
Yeah, sure. So, I mean, exercise, as we all know, is very important. It has multiple benefits, not just on cardiovascular health, but on pretty much all positive attributes to the body, including mental health and certain cancers also. There is a reduction in incidence of cancer, dementia, strokes, you name it. There's a benefit to exercise. So the recommendation, international agreed recommendation, is that we should be aiming for around 150 minutes of moderate exercise per week. And moderate exercise is difficult to define, but essentially it's anything where your heart rate is increased and you're able to talk, but perhaps able to hold a conversation with someone. And it could be a brisk walk, it could be a light jog, it could be a gentle swim, but we should be incorporating approximately 30 minutes of exercise 5 times a week. And that is enough to gain the benefits of exercise. You're absolutely right. There's some people who do far much more than that. And there's always been concern. One of my research questions when I was doing research in the UK is, could you do more? Could you do too much exercise? Can you have too much of a good thing? And the honest answer is that we've never been able to establish a deliberate harm caused by over-exercising. And we know that master athletes, they live longer. So on average, retired athletes, they live up to 3 to 6 years longer than their sedentary counterparts. So clearly athletes are doing something right? They're not dropping dead, as sometimes we often see in the media. People die in a marathon, or they die in a football stadium or in a basketball court. These are very rare scenarios. And it shouldn't discourage the general population that exercise on the whole is extremely beneficial. And, this program is aptly named, Aging with Attitude. And one of the things that interests me and have formed a large basis of my research is looking after master athletes. So these are individuals who, in their sort of middle years and older, they partake in competitive endurance exercise. So they do marathons, half marathons. And what is surprising to a lot of people is that, master athletics is a big thing, right? There are master athlete competitions that, enroll athletes who are above a certain age. There are world records and world championships, primarily for masters athletes. And that's why I feel that this particular topic today that we're discussing, aging with attitude, is that we often get the impression that as we get older, we should take it easy, maybe not do as much exercise. But to be honest, there's a lot of people who take exercise extremely seriously as they get older. And I find that truly inspiring. So yes, I think it's, we should be doing the bare minimum in terms of exercise, a mixture of aerobic exercise and strength exercises, as we've seen nicely demonstrated. But that should be the basis of things going forward. And it's not just for patients who have had a heart attack as part of cardiac rehabilitation. As you mentioned, Rita, we're talking about prehab, right? before you get into problems, it's advisable that you maintain an exercise regime. So yeah, that is kind of my take on exercise, and my take on exercise as we get older.
Well, thank you so much, Dr. Merghani. And I really feel that, you know, being in the Northern Health area or region, that we're very fortunate to have you here. Not only Prince George, but BC and Canada as well. And you know, so it makes me feel inspired. And the things that you've talked about are so in keeping with every episode that we have done in the past, everything from mental health and just maintaining our health. I have learned that, you know, having a heart issue, it knows no age, and people of any age can have it. I didn't feel like I was a prime candidate, but it happened. And twice it happened in the same, and I was lucky enough to get to the emergency room and have those heart attacks there. And they flew me down. It was February of last year. It was 30 below. It was in the middle of COVID. I didn't think to take any clothes so I could come back. I just thought, oh, that's it. Might as well. So then when I was discharged from the Kelowna hospital, they said, you can find your own way back. I had my pajamas on, and fortunate enough that I have family members that can come and pick me up. But, you know, that's the reality of what we're dealing with here. So he's so excited that there's something going to be happening in northern BC, and I'm also excited that there are things that I have found out there, like Pulse Cardiac Health, that can, you know, help us with that sense of community, when maybe we don't have that big ivory tower next door that has all the resources and facilities. So with that, Shawna, do you have any recap words that you'd like to share?
I just, you know, exercise obviously as a clinical exercise physiologist, and understanding the, you know, the relation of heart health and overall prevention. That's what we want to do, is prevent. I agree in the sense that exercise doesn't have to be the meeting the minimums. We have a person in particular in our program that is doing 1,000-kilometer bike rides. That's his marathon rides that we're training for him with him. And we have people that are in their 80s that are doing a phenomenal amount of exercise at very high intensity, I might add, which is just absolutely incredible. So I think it's something that that we all should be doing, that it's part of our lifestyle. It's just part of what you do, just like brushing your teeth. It doesn't have to be treacherous and a grind. It can be fun, but it does encapsulate the whole idea of overall lifestyle and eating healthy, being mentally well, managing your stress, coping, you know, quitting smoking, all of the things that we can do to give us a better chance at a longer life. And so, yeah, we are happy to help however we can.
So Shawna, maybe just talk a little bit about your logo, what it means, and a little bit about what people can find on your website relating to what we were just talking about this morning.
People on our website, sorry, say that again.
A little bit about what people can find, what they can find, okay. Like, you know, besides the Zoom classes. That's basically what I'm familiar with. But, you know, and then what your logo means. I heard it means something really cool.
Yeah, so our logo, we spent some time in New Zealand, and the unfurling fern was basically the standpoint of new beginnings, new life. And so we felt that it was quite fitting after someone has a heart event specifically, that they feel like, okay, I'm ready to tackle this new beginning. So that's what the fern kind of meant, this little spiral. And in terms of our program, we have people who are in the prevention standpoint, just needing to do some exercise potentially as a group. We have a library of education videos on every topic known to man in terms of cardiac world, as well as exercise videos. But then we actually have structured cardiac rehab programs as well. That's 12-week structured program where I'm giving you an exercise prescription week by week, as well as education content. We connect with you. Again, we have a cardiac nurse as part of our role. So we are one to be phoning you at 6:30 at night if you're having troubles. But yes, we kind of have two sides of our program, the more kind of enhanced rehab side, as well as the more basic kind of Zoom classes and exercise things in terms of the maintenance side. So we're happy to help however we can if anyone wants to reach out.
Thank you so much, Shawna. And Dr. Merghani, do you have any last words of wisdom that you've heard or maybe thought of since you last spoke?
Yeah, no, I think, to be honest, we value patients like yourself. I mean, it was really touching hearing your experience, Rita. And, you know, it just makes it all the more worthwhile. It gives a true, you know, patient perspective. And, you know, it's always nice to see, you know, patient's perspective. Rather than us seeing from it or hearing from it, it's nice to kind of get your perspective. And, you know, when you're on the other side of things, when you're the patient, it feels all the more real. So thank you very much for sharing your experience earlier.
Yes,
Well,
thank you.
thank you. And you know, I'm glad to be able to be helping to bring this episode to our viewers out there. And I just want to remind you that this thing can happen to anyone, and it happens in an instant. And you don't need to have any signs that lead up. And your heart does matter. And I'm so glad that, you know, it is so central to all of the other things that we do in life, whether it's mentally, physically, you know, educationally, nutritionally, everything. So, you know, I'd just like to, you know, thank our viewers. I know our time is going to be running out here pretty quick. And reminder of that website, Pulse Cardiac Health, if you'd like to maybe try out a Zoom session. Sean is really good at getting back. I'm one of those persons that, you know, can vouch for that. It's been a lifeline for me over this past year, and especially in the early months. And for myself, I had other complicating conditions, and I was in that first 6 months. I don't think anybody knows it unless you've went through a heart situation. But in that first 6 months, if you can't even go to the dentist, and you just keep your fingers crossed that nothing else happens to you. And it is not very nice being discharged from a hospital many miles away with no other clothes to wear, and you know, and the travel back in a vehicle is so uncomfortable. And you know, I know for me, I was flown down from the emergency in Prince George to the cardiac unit in Kelowna, and for me that was quite an experience. I didn't think to take any clothes with me. I just thought it was going to be my last plane trip. So I want to thank my guest, Shawna, from Pulse Cardiac Health, and Dr. Merghani, our new cardiologist in Prince George. I just feel so inspired that we have you here. And with that, I'd like to just wish the people out there in viewers land, just wish them well and look after your health, and your heart does matter. I'm Rita Weeb, and thank you for joining us. Till next time.